Is the vagina dirty?
That's the
Why
one
am I
question
cleaning
that we
it?
need to...
It's such a beautiful piece of organ.
So the vagina has its own secretions, which
Yes.
basically are to take out whatever. It's got its own natural microbiome, the bacterial environment that is present in the vagina.
If she wants to use a cucumber, is there evidence? How does she know that the vagina is smelling? Of course, if you have an odor, then you go to the doctor.
If you suddenly
Yes.
feel
So there must be
a change in
is
the...
there a
okay.
reason why we're using, you want the vagina to smell like a cucumber? It's
Yeah,
not.
it's not a cucumber.
It's not a
It must
cucumber.
smell like a vagina.
It's a vagina. It's not a pineapple.
It's not a
It doesn't bite. It doesn't have
Cayenne pepper.
Oh my goodness.
Hi guys, welcome to our third episode now, and today we're going to be delving deep into issues pertaining women's health, and I'd like to apologize. Initially, I'm diving into an area that is not my forte, and I'm going to be asking a lot of questions. Some might be quite sensitive, and some people might find in another way. I just want you guys to understand that this is for the purpose of educating and making sure that people know enough. Thank you for all the support on the previous episodes. If you haven't watched the previous episodes, I'd encourage you to, and to also subscribe and share the content to other people. So today I have two guests. Every time on Thursdays when my family and everyone that is in my life, whenever they're trying to look for me, I'm always stuck with these two amazing women, two specialist gynecologists. So I've got Dr. Masego and Dr. Masina that I work with. There's a number of things that we actually talk about when we're working together. I think the one question I've never asked you guys is, how did you meet?
Okay, I'll let Dr. Masego say how did we meet.
we met at Witbank Hospital in Mpumalanga, 2013. I was doing my ComServe and Dr. Masina was a medical officer.
Okay. And at that time you guys had decided we're going the gynae route.
Well, yes.
Yes.
I just finished my ComServe and she was also interested in the specialty, trying to gain some experience, and we were just wet behind the ears, junior doctors very eager, and we were running together.
What made you think about gynae? Like there's so much that you could have done. Forensic medicine.
Because I'm for women and I'm for children. If there's no mother, if the mother is sick, that home is not well. So gynae, because I'm for women and I'm for children.
And how has it been working together?
Well, since 2013, via post-grad registrar time, and then we meet again in Cape Town. So I guess it's been amazing.
Cool, I see it. I mean, you guys flow quite well. It's actually very nice to work with you. I never really say this when we're in theater together, but they are very amazing people to work with. Like Thursdays are usually quite amazing. More often than not, people go to see a GP, go to see a doctor, and I always wonder, like, how does a person delineate between a situation where they need to go straight to a gynecologist or they need to go to a GP, or how do you play around? Who needs a gynae consult?
Every woman needs a gynae consultation, whether it's just to introduce yourself to the gynae or to bring your specific female problems. So if you're a young girl who's starting out with puberty, I would suggest you have a once-off consultation with a gynae, because then we do the sex education talk, we introduce things like HPV vaccination, we teach about what to expect, what is normal of your period, and we establishing a relationship basically, because we are hoping that we know that at some point this young girl will probably come without their mother, they'll be seeking contraception. This young girl may come back with maybe a funny discharge that they don't want to discuss in front of their parents. So basically, I think every woman deserves to have a gynae. It's like a dentist. That's what I always say. Like you schedule your gynae appointment like you schedule your dental checkup, like once every 6 months. I know we're all guilty of not keeping to our once in 6 months, but you should have a regular gynae checkup just like that.
Yeah. And then, you know how we always say, like, for example, if a patient is coming to theater for an op, I'll say, okay, no makeup, no earrings, fast this long, you should not eat, you need to take your medication, or you need not to take this. Is there particular advice or a manner that a person needs to conduct themselves or preparing to actually go for a gynae visit?
I think personally, one, they should know that they're going to a gynae consult. So we ask gynae questions. So from the history, we will ask gynae specific questions, which may be sexual history, things like that. So from a history perspective, they must be aware we're going to ask those kind of questions. But
so they must be prepared to answer questions that are coming to that, not people being shy around talking about that.
Yes, we're going to talk about that. The gynae is going to call it a vagina. You know, the gynae is not going to say, oh, you know, your private part. So first of all, from the history, they must know we're going to talk about gynae. And then physically, I think they should be comfortable. Once again, it's a gynae exam. So a gynae exam is not a hair exam. It's not. I'm not going to examine your head. I'm going to do a gynae exam. So which means you must be comfortable. There will be some undressing. So somebody must know that there will be some undressing. The stuff or the instruments that we use will be used in the gynae area. I think somebody must be comfortable in their body.
Is it that easy when it comes to, you were talking about teenagers and young people, sometimes they have to be accompanied by their parents, and they sometimes have to touch on things that are happening in their lives, and they're not comfortable with talking when there's mothers and all of that. So how do you do around that?
So remember, as a doctor, your client is the person that's sitting in front of you. Even if they are minors, we still need consent. We need to consent to have the parent in the room with them. If they're comfortable with that, we need to have consent in terms of examining them. We explain to them what's going to happen. And if they do insist on having their parent there, like usually when I put them aside in the room, just about to undress or we're doing the weight, I would just whisper maybe like, are you sexually active? You know, so that I don't also get them in trouble, and they can nod or just shake their head, and then I know how far I can go. Some of them will just laugh out loud and say, oh no, I'm not. Oh, mommy already knows that there's a boyfriend in the picture, and but there's a way of getting around it without actually getting anyone in trouble.
Funny, when we were doing our gynae rotation, I think I was doing 5th year, and then a lady comes in and the husband was walking behind, and then the specialist that I was in the clinic with was asking, so mommy, how many pregnancies have you had? And the patient was like, 2. So now we had to find a way of
What is 2?
what does 2 mean? You know, because the husband couldn't see the 4 fingers in front. And now we had to find a way of getting the husband to walk a little bit out so that we can remain with her. And it turns out she had a miscarriage, and she had an abortion previously prior to them encountering each other. And the husband only knows the latter part of the life and all of that. So these things of confidentiality and stuff actually are very important. I wanted to ask, now you were talking about types of exams and everything. Pap smears, who must go for a pap smear? When do we start doing pap smears?
Okay, so one, it's all sexually active adults from the age of 25. We're supposed to have your pap smear. And then depending on the results, they'll tell you have to repeat it in a year or you have to come back in 3 years. So anybody who's sexually active above the age of 25 up until 65.
So if you're younger than that, it's not necessarily recommended.
So remember, pap smear we're screening for cervical cancer. And cervical cancer, the most common reason we have cervical cancer is persistent HPV infection. So we find that in the younger population, that is younger than 25, up to 85% of people who are sexually active will be exposed to HPV at some point in their lives. So if we do the pap smears too early, then we may tend to overtreat. So your body naturally will clear HPV if you're immunocompetent, but some people are then prone to persistent infection, and those are the people that we would want to pick up with a pap smear. So hence we start, if you're sexually active, we start from the age of 25, and we do our pap smears now with HPV screening. Then depending on whether there is HPV or not, then you are triaged into one arm, or if you've got abnormal cells with or without HPV, then you are triaged into another arm. So that is the reason we
started started early. And then the vaccine for HPV prevention? I think it gets a bit tricky because children nowadays start sexual engagement a little bit early on in life. And what recommendation is there? Like, how do you, when our girls, when should we send them for HPV
So it's
vaccination?
licensed for use from the age of 9. We are hoping and praying that by that age they are not yet sexually active.
Yeah.
They are still pre-pubertal, but basically that's the reason we started between the age of 9 and 14, or in middle school, so before sexual debut. So that is the recommended, but actually anyone, even adults, it doesn't matter whether you are sexually active or not, you can actually get vaccinated for HPV because it covers a lot of viruses. So it doesn't only cover one specific type of virus. So even if you have been exposed to one type, you will still get the benefit of being
the
covered
other ones.
for the other
Okay.
ones.
So if you missed the 9-year mark, then
So
you can
then
go
today
through.
you can also go, because remember, it doesn't only prevent cervical cancer, it's prevention of all HPV-associated genital diseases like your warts. For the male, it's penile cancer, rectal cancer. What is this? The laryngeal cancer as well.
Yeah.
Yes.
So even little boys now need to have an
So
HPV.
it is advisable
It's
that
advisable.
all
Okay.
young people actually.
Oh, okay,
That's
okay.
the only way we can get rid of HPV.
I see.
If you look at the latest Road to Health card, at the bottom where they listed the vaccines, it is written HPV.
Okay.
Maybe I would say in the last 2 years, the HPV is there.
Has been
But
added
it has
to
been
the
added,
AP.
yes. But if you look at the Road to Health card, like 10 years ago, the HPV is not, it did, but now it's there. So parents must just look, it's at the bottom. There is HPV.
Oh, it's written. So
It's
if it's
written
written in
HPV.
the Road to Health card, does that then imply that it is part of the vaccines that are provided by government, or you?
Yes.
Okay, so they do
Yes,
provide
yes,
it there.
yes,
Oh, okay, that makes
So a lot
of
of parents
sense.
will say at school they've had the conversation, but just that some parents didn't understand.
They don't understand what it is about.
What for, yeah.
Okay. I see. And then, so a lot of people will go for a gynae, but there are people who find some particular symptoms or things happening, and we find a lot of people using self-help things like those douching things, TikTok stuff. Yeah. those douching things and other products that I said to clean the vagina, like very well, or all of those things that talk about pH and that stuff. What's your take on that, like, and how people handle that whole business?
Is the vagina dirty?
That's the
Why
one
are we
question
cleaning
that we
it?
need.
It's such a beautiful piece of organ. Why is it dirty?
When we were in medical school, there was a mantra that the vagina is a self-cleaning oven. So the vagina doesn't need to be cleaned because it self-cleans.
What do you mean by self-clean?
So the vagina has its own secretions, which basically are to take out whatever. It's got its own natural microbiome, the bacterial environment that is present in the vagina, that is actually to protect a woman from certain infections, including thrush. Obviously, when there is a shift in that natural bacterial environment, we all carry bacteria. Even in your mouth, you carry bacteria. So I don't know why it's frowned upon when suddenly it's in the
suddenly
vagina.
in the vagina.
I mean,
Because people don't clean
even
their
on
teeth.
your skin, you've got bacteria.
don't clean
Nobody's
their teeth like
sterile,
that.
you know. Even
Yeah.
on your skin, you've got bacteria. So
People don't
it's a
steam their
self-cleaning
teeth.
People
organ.
don't steam the...
or their mouth.
It's got its own natural environment that it must maintain. So applying
all of these things.
all of these things, number
Yeah.
one, it changes that environment, and then it actually leads to more problems than benefit.
And then the stuff that people say you must eat, like cucumber, to make it smell nicer and stuff, as if a vagina needs to smell like
But
something
that's-
else that
that's
is
what
not.
You're asking, first of all, before the person uses those things, is the vagina dirty? And what's the evidence that the vagina is dirty and hence she must clean it? If she wants to use a cucumber, is the evidence? How does she know that the vagina is smelling? Of course, if you have an odor, then you go to the doctor.
If you suddenly
Yes.
feel
So there must be
a change
yes,
in
is
the...
the
okay.
reason why we're using, you want the vagina to smell like a cucumber. It's
Yeah,
not
it's
a
not a cucumber.
It's not a
It must be
cucumber.
like a
Pineapple.
It's a
vagina.
vagina. It's not a pineapple.
It's not a
It doesn't
pineapple
bite.
either.
It doesn't
Cayenne pepper.
Oh my goodness, it gets worse.
No.
And also, I mean,
anyone's
so
vagina.
interesting. It's so interesting how
Imagine
people
how
will
soft the
do it.
vagina is. Now you put in
And then-
pineapple.
Yeah. No, I get it. And imagine it's
And
not even in the...
it's a mucosal surface. Imagine putting stuff in your eye. So think about it like that.
And pineapple and cucumber are not even men's favorite flavors.
Oh, is it now?
No, we don't like we are not into cucumber and pineapple. Like,
so I wish we had a patient. I wish we had a patient to explain where is the cucumber coming from. So and why pineapple?
They usually write like if you eat pineapples, for example, it makes you smell like pineapple, as if like that all these phytochemicals that are in the pineapple bypass the stomach, bypass every area,
and go straight to the
there. Like your eyes are not going to smell like pineapple. It's just going to go there, straight to the vagina and stuff.
There is no scientific evidence that supports that
all of that stuff.
It works. And also, like we say, the vagina should smell like a vagina, not like a pineapple.
And then there's vaginal shower gels and that come out. So what should people use to wash then?
Water.
Just water. Water flavored water.
Yes.
No.
The take-home message: it must smell like a vagina.
Okay.
If you think there's an odor, by all means you go to the doctor and you're prescribed whatever.
I always try to find the root of all of this. It's as if people are trying to, and I don't know, like why people have this sudden urge that they want to smell in a particular way, as if it makes a difference.
Isn't it just a stigma that people have decided that vaginas smell or smell badly? And I think it's more that than anything. Like we say, a vagina must smell like a vagina. It shouldn't smell like a fruit. It's not a fruit. And I think every woman is aware of their own natural smell. And obviously, like Dr. Masego has said, if the odor has changed or there's a foul-smelling odor, then there is a problem. Rather go see a doctor. There's no need to be self-medicating and using fruit and...
And you know what? These things, they get stuck. The cucumber gets stuck in the vagina. The banana gets stuck in the vagina.
Yeah, because sometimes people don't just take them in, they will put them in.
So,
and then they go to hospital and
and then the guy must come out to
remove all of that stuff. I see.
And then now it's embarrassing because we're going to ask, and why was the cucumber in there?
How did the cucumber end up there?
But I mean, we're not going to judge, we'll remove it. Yes. But I'm just saying then the things get stuck.
But there's no things like foods.
But also think about it. So it depends. Do they put it in their mouth? If you put it in the mouth, what's the route? Is from the mouth to the stomach?
And then to the digestive system.
To the digestive system, so it doesn't get to the vagina.
It doesn't get to the vagina at all.
Unless if you put it directly in the vagina, maybe. I don't know.
But then again, you are providing food for bacteria.
Yes.
And then it gets worse. Then you develop yeasts and all of those things. And then so there's that fascination with that. And then there's this fascination with vaginal tightening creams, vaginal tightening machines, as people have got this sense of insecurity about how tight their organs are, as if they're supposed to be, guys on the other end are worried about how small their organs are. So everybody wants a big one. And then women on the other side want a very small one. And I wonder if this one's goals were achieved and this one's goals were achieved, what will happen? Do you know what I mean? Yeah. So
we would be jobless.
We'll be jobless because no one is going to get pregnant.
No, but like what do you normally advise people when they come around stuff like that, when they're worried about that? For example, people get pregnant, have first child, second child, third child, and people are worried that all of a sudden their partners are going to go to leave them for assumed more nicer people and all of that.
So I think first we find out from the history, why does she think her vagina is big or loose? So we ask obstetric history and delivery history. When you delivered children, anything happened. Did you have a perineal tear? Did you have a third-degree tear? And where was it repaired? So we want to try and find out, is there evidence that there was a trauma? Because some of them will say, no, I haven't. I actually delivered by Caesar. So then where is this coming from that you think your vagina is bigger or loose? Yes. Of course, there will be those patients who say, I had a traumatic normal delivery. I ended up being repaired in theatre. And then you examine the patient, and when we examine, we look for the sphincter. So basically, we're looking, is there evidence of a perineal injury? I think from a clinical point, those we cannot ignore that. So there is things like that where a patient had a perineal trauma during delivery. So that
and then
is
the muscle
valid.
is torn.
So that is valid. But then other patients, they don't have that. I don't know how then we'll address that. If there's no history, and when you examine, there's no evidence.
And also remember, a vagina is a muscle, so it stretches, especially if you've given childbirth, there is a bit of stretch. It will rebound. It's like a balloon. Even if you blow up a balloon, although the balloon will deflate, but it will never be like a vaginal or a virginal vagina.
It will never go back to like what a person
However,
is a
because
virgin.
this thing is a muscle, it still functions the way it should function. So I don't know what's the fascination with wanting to have, I don't know, a 2 millimeter diameter vagina, because that's
So now you're
obviously
50 years
gonna
old, but your
end up
introitus is like a
causing
2-year-old.
This is how people are swearing at each other, even on social media. So you've got a big one.
But that's what I'm saying. So you're 50, but you want to have a vagina of a 2-year-old. Is that
so
how
it means we're not educated.
We're not educated.
I mean, does it make sense?
Or probably it's males, because we cannot ignore that part. It's males causing unnecessary pressure on the women. But
Yes.
just think about it. You're 50, you've had 5 children that you delivered normal.
Yes.
Now the vagina must be like a 10-year-old.
Yes, I get it. And then things like Kegels.
Yes, we do Kegel exercises to improve pelvic floor muscle tone, because obviously you need that as well for all your sphincter tones and whatnot. But in terms of tightening the vagina, the vagina is an independent organ. There are other modalities, like people use laser. There's like ultrasound devices that tend to rejuvenate or improve the collagen or elasticity of the vagina.
Those rod things that people insert and then
Yes,
start.
there's even
that.
chairs that you sit on and it shakes up
Technology.
the insides. Technology. So those things have now come to the forefront, and all of this to try and improve the woman's confidence, also in terms of sexual liberation and confidence in that department. However, I don't know to what extent do they make a difference.
But I think men must be
The
educated
jury is
also.
still out.
Men must be educated, because if, for instance, you have your first child with your wife, then now after delivery you start looking at her funny. Where are you getting that? So men must empower women, because she just gave birth, so obviously she feels somehow. So you are there to support her. But the moment you start saying those things, that's when now she's going to start putting cucumbers. She wants to come for vaginal tightening. I think men play a big role. Or your facial expressions or whatever, I don't know.
Yeah, or how you think about these things, you know. Yeah. Also, I mean, eventually it adapts to the person that is constantly
Occupying the space.
you know.
Yes.
Yeah, so it'll come back together. And just recently we were together in theater. We were doing a Caesar. What happened?
So we were doing a cesarean section, and that lady had a Mirena or an IUCD that dislodged. Hence, she fell pregnant.
So she had a loop.
She had a loop that was inserted, I think, 2 years ago, and then.
Unfortunately, the child didn't come out carrying it themselves.
No, the child was
never
not carried,
happens.
it was just there.
It was just parked there.
Yeah, it was just
When
parked
does
there.
it fail? How does it fail? And how do you protect yourself from it failing?
First of all, if you look at the manufacturer's pamphlet, it does say there is an expulsion, so it can come out.
Okay.
And it depends when. So if you insert it during a Caesar, it has like during delivery or within the first 6 of delivery, it has a much higher chance of coming out. Okay. And up until the 5 years duration, so it does have a chance of coming out.
So how often should a person get it checked then?
As a general rule, when we insert it, come back 6 weeks later to check for placement. Okay. So it can come out or it can go any other place. Okay. So which means it can go to the other organs, you know. So it can move, basically.
It can move
So it can
around.
move. By expulsion, I mean it can come out.
It can come out of the
yes,
the
and then she
uterus.
falls pregnant. But when it comes to the gynae, they say there's no loop. But she insists that I put it. So it means in that case that one came out.
That one came out.
So sometimes she is pregnant, but the loop is found, but it's facing that way. So
The other
it
direction.
moved.
Okay.
Yes.
So it's offside position. It's not
And
where
then
it's
the sperm.
supposed to be. Then the sperm does what it does best. Okay. You go for the first consult, it's inserted, and then you have that follow-up. Like, is it possible for it to fall off like 2 years later? Or so how often should you go? Or maybe whenever you're seeing your gynae, they should put in a scan to see if it's in the right position. Because I mean, some of us are a little bit old now for having other kids. You know what I mean? You don't want a surprise pregnancy while you're busy. With your life. You know.
I do offer my patients an annual review of the IUCD, just to make sure that it's still in place. But generally, like Dr. Masego was saying, that after the 6 weeks, if it's in place, because most likely you've had your period, and the highest rate of expulsion is in the first 6 weeks, or expulsion or displacement is in the first 6 weeks. So if it's found that it's in place after that initial 6 weeks, then it should be in place again. You tell your patient it shouldn't be uncomfortable. So if either you or your partner is experiencing discomfort from it, most likely it has displaced. So you shouldn't be aware that your IUD is there. You know in your head that it's there, but you shouldn't always be conscious that it's there. It shouldn't be painful. Your partner shouldn't feel it, you know. So that's also a sign. So if any of those things...
But sometimes guys complain when it's cut too long or when it's cut too short. Yeah, I need to represent guys at some point in time. They must be well represented.
Sometimes what they don't know, they don't feel.
The string is actually very soft. It is very soft. But then, fair enough, it's a complaint that patients come with, and we look and we examine and we can cut it shorter. But
or
remember,
you find the string is coiled up there,
but then
and you
remember
know that there's no way.
that string, we need it when we take it out. So we cannot cut the string completely, because when you take it out, we need the same string so that we can be taken out. Yes.
And actually, if it's too short, that's when it actually pokes. So you want it to have some length to actually curl
around
Oh,
the
you want it to
cervix.
curl.
Yes.
Okay, I see.
Just like here,
I see.
so that it doesn't.
And then, so that's just one modality of contraception. And now you find people who are complaining, like people who've inserted their implants, for example, that I'm gaining weight because of this. Does the stuff make you gain weight, or does it make you have an appetite, like an appetite that's innocent, uncontrollable? You know?
Maybe give us an example. Gaining weight, like how? From 50 kg to 100? Is that what you mean? Or you mean from 50 to 51?
So contraception is not a one-size-fits-all, number one.
Yes.
What works for me is not what works for Ngami. It's not what's going to work for your wife. So there's no perfect contraception. Contraception does have some side effects. So the side effects are real, and we don't experience them all in the same manner. If, for example, you are on oral contraceptive and you are complaining of a lot of mood swings and whatnot, we always try and give one with like the lowest dose that will have the lowest dose that is effective. So obviously minimal side effect profile as well. So not all COCs are the same. So you find one that works best for you if you feel that the COC is what you need. There's a patch that if you feel like a daily tablet may be a problem, you can use a patch that you can apply weekly. There's injections, which also have their own issues, but generally a lot of people, if you counsel them well on the side effects of contraception, they can tolerate them. So depending on the motivation as well. If this woman is forced to use this contraception and they actually don't want, every small bit of nausea, bit of headache, they are going to complain. The progestins, they can cause some weight gain, but the companies say only up to 4 kilograms per year. So with a little bit of water retention, there is a slight increase in your appetite, but obviously you can see yourself if you are now eating half a loaf of bread instead of 2 slices. I mean,
And you can just try and jog off the 4 kgs. I don't think 4 kgs is very difficult to run.
So the main thing about the contraceptives, like Dr. Masina said, they all have side effects. And if a particular side effect the patient cannot cope, patient must come back to the gynae or to the doctor and explain their side effects.
And not just decide they're going to stop.
Because then now the patient will say, I stopped and now I'm pregnant. That's not a very nice move. So I mean, I know a lot of patients will complain about thinning of their hair. Come back to us, let's talk. Doctor, I think my hair is thinning. And we go back and we decide, okay, what else can we use? There's lots of them with different concentrations, and we look at the patient profile.
Do they ever contribute to infertility? Like if you start a particular type of contraceptive, then once you stop, it might cause you not to have kids again? Because some people are afraid of the hormonal ones because they think once you start them, they might make you have problems having kids in the future.
Not infertility. We maybe can say it takes time for fertility to return, but does not mean you'll never have children.
Okay.
You'll never. That doesn't mean that you are infertile. You just took longer to fall pregnant.
Long-term use of contraception doesn't cause infertility.
It doesn't. And then early onset on children?
No.
It doesn't, because now, like, you find people who have got kids that start being sexually active very early in life, and they start contraceptives and they worry about their future.
The commonest cause of infertility in women is tubal factor infertility, and tubal factor infertility is caused generally by untreated pelvic inflammatory disease. So
STI.
Yes, so we need to educate again, education. Just because the teenager is not seen getting pregnant doesn't mean that they're protected from everything. So you always need to use dual contraception. We always advise condoms and a hormonal method.
And a hormonal method as well. And then lastly, before we go, like if there was one thing that you want your patients to know, if there was a take-home message.
Contraception.
But then if there's contraceptions, you're not going to come to theatre and then I'm going to starve. So people must...
But patients must use contraception.
Yes.
Because they must plan for the pregnancies. It is advisable that the
How do you plan for a pregnancy, and what are you supposed to do? Like if you're a person, you're like, okay, now I need to have a kid.
Do you have money for the child?
Okay. Very important.
Okay, but on a serious note, I think kids, we must try and have planned pregnancies. Of course, it's obvious from a financial point of view, try and have the child planned so that you are able to afford the child. And then from a health perspective, so it's a whole lot of things. If you have existing medical conditions and you're taking certain medications, for instance, so you want to optimize whatever medical condition that you have. For instance, if you're diabetic, you want to make sure that your sugar controls are good before you fall pregnant. For instance, if you're epileptic and you're using certain drugs, you want to make sure that you're not taking those drugs while you're falling pregnant, because those drugs are teratogenic in pregnancy. Another example is if you're overweight, you want to make sure that you lose a little bit of weight, maybe about 10% of your starting body weight, because it has an impact on your reproductive potential and your pregnancy going forward. So it's not just about finances. Yes, it's important, but from a medical point of view, we want to optimize your medical conditions that you have, optimize your weight, have folic acid, how old are you, there's a lot of things. Stop alcohol.
Yes.
Very important.
So I always tell my patients, like, if you are planning on getting pregnant, already start behaving as if you are pregnant, because remember, ovulation always happens before you miss the period. So you may be having a jowl and binge drinking and smoking, and then you get pregnant in that same weekend. You've already exposed your unborn baby to teratogens. So what Dr. Masego was talking about is preconception counseling. So we want ideally everyone to maybe plan their pregnancies, get that consultation so that those issues can be addressed. Like, your folic acid is most effective if you at least start taking it at least a month before you actually conceive.
Or not when you're already pregnant. I see.
So at least before you start, before you conceive, eliminate the medication that could be teratogenic, because again, the baby is forming rapidly in the first few weeks. Most people are not even aware.
Teratogenic stuff is the stuff that's going to make the child deformed.
Yes, so most people are not even aware that they're pregnant,
Yes.
and already, damage is happening. So preconception counseling is actually very important. So you must behave as if you're already pregnant when you're planning to get pregnant.
Smoking? I've seen a lot of
Nobody
people
should
who just
smoke.
don't smoke,
Nobody
who
should
will
smoke.
stop everything
Nobody should
and keep the
smoke.
smoking. Some people actually do that, like, Doc, I've stopped drinking.
Nobody should
But,
smoke in
but
any
the-
case. Nobody.
Generally, nobody should be
the
smoking.
nicotine in the smoke is not innocent.
It's not innocent, so it's going to ruin the child.
It's a drug.
In terms of termination of pregnancy or miscarriages or elective termination of pregnancy, generally speaking, how much does that have an impact on a person's future pregnancies?
First of all, you're raising a good point. Every woman has a right to terminate for whatever reason, whether financial, social, as long as it's done in the right place and at the right time in terms of gestation of the weeks. So to answer your question, I would say it depends where and how was this done. There is something called backstreet abortion where it's done. And I'm sure in most towns, in most major towns in South Africa, you'll see
those posters.
It's written what?
Mama so and so.
Mama so and so, fast and fast
abortion.
painless abortion.
Yes.
So, those are considered backstreet abortions. You don't know what drugs they're using, what medication they're using. They use instruments, so obviously that has a lot of effect. Patients get septic from that. They get septic, get infected, and then that patient can end up losing the womb. So we must make sure, much as everybody has a right to terminate, it must be done at the right time, at the right place, so that we avoid having septic miscarriages that then lead to infertility. But if it's done clean by the right person,
then it doesn't have much of an impact on a person's future pregnancies.
So yes, what Dr. Masel was saying, in South Africa, let's speak about our country, because there's
Other
currently
countries have got different policies.
a lot of controversy and laws changing around the world currently. But in South Africa, we're still fortunate that the Choice of Termination of Pregnancy Act, it protects women that they can choose to terminate their pregnancies up to 13 weeks of gestation if they discuss it with their healthcare provider on request, and up to 20 weeks if it has an impact on their social, economic or psychological impact. So yes, because it's legal, then it should be done in a institution that is designated and approved by the government to be performing safe termination of pregnancies, because it's a medical procedure. So that way we actually are certain that the pregnancy is sitting in the right place. You're not going to be doing terminations on ectopic pregnancies. Number two, the instruments that are used or the procedure itself is done by trained staff. It's done in a sterile manner, and that way then you know that your pelvic organs or reproductive organs are safe, and it shouldn't have a bearing on your future fertility prospects. And then always we offer reliable contraception, because
goes back to
ideally
contraception.
we should plan our pregnancies and not be caught by surprise by a pregnancy.
So it doesn't make sense for someone to terminate, but then when we discharge, can we? No, I don't want.
Yes.
Well, you can, it's all right, but we're just trying to say you were in this position. Maybe let's try and prevent you not being in the same position 2 months later.
Yeah. Just to make it trail a little bit, can I choose my child's gender? Like if I want a boy or I want a girl? Do you know, I'm like,
why?
Why not? Like, people actually want, for example, like I know people who have had a girl, now looking for a boy, has a girl again. And in our culture, we've heard of stories where a person will even hop off to a next relationship thinking that their partner doesn't have capacity to actually have a boy. They go that side, have a girl, and then it goes on, but with in vitro fertilization and all of that.
Maybe let's talk about that. What
carries
sex determination? Where does the gene come from?
It's the man, obviously. It's the man.
So I think that's
so
what we must not underplay. That
so
comes
I
from
should be the
men
one
actually.
who's firing the right shot.
Yes. First things first.
Okay, understandable. But the reality is that it's hard. For example, I think growing up when I was in medical school, I'm not sure if this is actually correct, but like when you actually engage in sexual intercourse will determine whether or not your child becomes a girl or a boy. Does it still stand? Some people will say if you do it closer to ovulation, because
okay. I thought you meant in terms of age.
No, in
okay.
terms of timing, right?
Oh,
Because
okay.
your Y sperms are going to travel faster and your eggs are going to be slower, but they're going to survive a little bit.
Just when I thought I had it all, I never had this one before.
You've never heard that
I
one.
never had
You've never
this
heard that one before. Yeah.
All I know is you're going to
in a
get
conversation
pregnant.
or something and stuff, but like there's
Or
a lot
in
of
the
things that
morning, or in
people
the
think they know.
In the morning it's a girl, in the evening,
In the evening, it's a boy. Like if you see, we know that day 14 is there, right? So we're gonna wait, and
All I know is a guy who are going to get pregnant.
Try your socks on, without your socks
without
on.
your socks on. Yeah, but like, how do you play around that? Like when people for in vitro fertilization, for example, like can we pick that we want a boy child, we want a girl child?
I think gender selection in South Africa is currently illegal.
Illegal.
Okay,
Yeah,
in South
because-
Africa it's illegal.
Currently,
Okay.
yes.
Okay.
Because obviously that also has impact on
Population
the social
dynamics.
population dynamics. I don't think anybody wants a girl. Number one, everybody will be always, or 80% of people will always choose.
Shame, there are some daddies who really, there are some
When they have two boys,
there are some daddies who
then
really
on
like
the
their
third-
girls.
Then on the
Yes.
third time, they're like, yeah, it's a
can I
girl.
get a
But
girl?
often you get disappointment when it's a girl.
And the silence in the room when you're scanning.
When
and
you're
you say,
scanning
oh,
and then it's a girl, everybody just keeps quiet. But when it's a
That's
boy,
not nice.
Yeah.
That's
when
not
it's a
nice.
boy,
I always wonder how this
So
fetus
I think
feels.
it's a good thing that we actually can't choose, because again, what are you going to do with 80% population being male? The human species is going to die.
Guys, we must stop that silence.
And it's going to be,
But
and it's
people-
going to be chaotic. Women bring order.
you know. I remember my firstborn
The
kid is
silence
a
in
girl.
the room, no.
My firstborn child is a girl. My second born child is a girl, right? I was just silently hoping for a boy on the second one. It was a girl, right? Third time around, I was like, oh Lord, come on, just one. I mean, I love the girls, like I enjoy the girls, like, and I'm taking very good care of them. Just throw in a man there, you know. And it was a boy, and I was so excited. I probably would have been that excited if it was boys, and I wanted a girl.
Yes,
You know.
but you know, some of them, they just make it so obvious.
awkward,
And so,
and-
sometimes the patient or the woman cries
Because
she's just like,
it's as
oh
if-
my goodness, it's a third girl again. And I think society has made it like it's her fault.
It's a girl's
so
fault.
it's really not nice when she's crying. This woman is bringing a precious, healthy baby to you. Now she's crying. She's supposed to receive with...
We are just supposed to be a society that is appreciative of whatever child comes and just love them as they come. And some people, if you're not meant to have boys, you're not going to have boys. If you're not meant to have girls, you're not going to have girls. I've got a friend of mine, he's one of my pastors, he's got only boys. He has been hoping for a girl all his life. He has never, like, and he loves girl children a lot, you know. Where can people get a hold of you guys when they're looking for gynaes around? Where can people find you?
We're based at Melomet Mitchell's Plain in Cape Town. Yeah.
Yeah, we are based in Melomet Mitchell's Plain. I've also got a podcast, a YouTube channel. It's called Rewritten Girls. So we also discuss a lot of gynae information for the general public, especially our young women.
Well, guys, you've heard it. These are people that I work with. They're very amazing gynecologists. They work here in Cape Town. I work with them in the Melamid hospitals. And Dr. Masina has a YouTube channel that digs deep into this stuff. So I didn't dig a lot into the stuff. If you want more information, you can actually find it there. Right. Catch you next time on another exciting one.